The pandemic has made our lives a lot harder, especially when it comes to our mental health. And being that this month is Suicide Prevention Month, we brought on Dr. Sarah Martin, a child and adolescent psychiatrist with Texas Tech Physicians of El Paso, to tell us a little bit about how we can make it all easier. Dr. Martin, thank you so much for joining us.
Oh, thank you for having me.
Well, it's great to have you back on the show. Tell us a little bit about ways that we can make this time a little bit better when a lot of us are struggling so much with those feelings of depression and anxiety during the pandemic.
Well, one of the best things you can do if you're actually feeling depressed and it lasts longer than a couple weeks is to get treatment. And treatment can be accessed in many different ways, but the easiest is to start with your primary care provider. We do have a new service. The whole state of Texas has a new service to help primary care providers treat their patients that have psychiatric problems. So hopefully primary care providers will also get a little extra help if they have patients that are feeling depressed. But the things you can do as an individual at your own house to prevent depression or to improve any depressive feelings that you're having one is to have some social contact. That's hard these days, and that's one of the things that a lot of psychiatrists are worried about. But also go outside. Fresh air, sunshine, and contact with friends can go a long way in treating a mild case of depression. But if it's not mild and suicidal thoughts start to come up, then you have to get treatment. The suicide rate in El Paso is relatively low, but even one suicide is too many. So if people would get treatment when they first start feeling depressed, there would be a lot lower chance for that person to ever even think about suicide as an option. So we really stress early treatment. The sooner the better. And we hope that people will start doing this, and we hope that as shows like this are on regular TV, that the stigma that prevents people from getting the help they need, we hope that stigma will reduce. And it is reducing over the years, but we need even more, because everybody that is feeling depressed and it doesn't go away after a couple of weeks, we hope they do get treatment.
Dr. Martin, what an important reminder that help is always available. And hey, a reminder to all of us to reach out and stay connected even when we have to stay apart. Dr. Martin, thank you so much for joining us.
Thanks for having me. Take care.
Stay with us. We'll be right back.